I'm just so delighted to see you, to be honest.
Oh, yeah. Yeah, no, it's been like I mean, very long time.
Yeah, it's been a long time. Yeah,
Yeah.
yeah. Zion, I met you. Well, I did we meet before that transgender leadership conference? Probably. Yeah, we
You talking
did.
about the task force thing?
Yeah, yeah,
Yeah, yeah, because I lived
yeah.
in Durham.
That's right. We met at a party and stuff.
Yeah, I was in Durham for a
Yeah,
while. Yeah.
yeah. Well, I was really excited to ask you to do this Why Live thing because I think of you as a true iconoclast. Like you're somebody who doesn't like I just saw a post that you did where you're like, I don't I don't have pride. I'm not all about
Uh,
pride. And what else did you say? What did you say?
oh, like love doesn't trump hate. Vodka
Yeah.
sucks.
And allies are like for fuck allies. And I was
I
like,
mean, what is it?
yeah, exactly. And I was like, yes. And yet you are someone who is a doula who has chickens, who has children, who conveys this incredible joy about your partner and about all these things in your life, you know. So I was like, I need to, you know, talk to this person.
Thank you, Sam. I appreciate yeah, I appreciate you saying that.
Yeah. So all that's kind of my intro of you is I'm just fascinated. You are totally your own person, and I really truly enjoy that.
Well, thank you. You know, my day to day, I'm a nursing student in an accelerated program
Mm-hmm.
um, at the University of Louisville. So, like, you know, clinicals. And funny thing is, like, I'm actually in psych right now. Like, we're
Oh,
taking
wild. Oh,
our psych
wild.
class. So, like, I'm, you know, in clinic at a like a residential, like a secure residential facility in Kentucky, Louisville, Kentucky.
Oh, and oh, okay. I heard
Yeah.
Louisville. Yeah,
Oh
Kentucky.
yeah, I
Cool.
know. Yeah, at a yeah. So that's been interesting, but
Mm.
yeah, like yeah. I mean, I think for the most part, like it's been like super a bit of a journey as of late. You know, like I think I don't know when I was like 16 or 17. Maybe, I'm bad with like age, like maybe like even 19 or something. I don't know. You know, as like formally like diagnosed with severe depression and like had been
Mm.
like on medication for it for like a very long time. Recently saw a psychiatrist for the first time in my life. Like I'd seen my psychologist, had never seen a psychiatrist.
Oh, wow.
But also too, like when I was in undergrad in North Carolina, yeah, like I knew something was up. Like I had to like
Yeah.
take remedial math like 6 times. um,
Same.
right, yeah, and
Truly.
like you know, I was just like, what the, you know, like what the fuck is going on? Like before
Yeah,
getting out
yeah.
of it, and like nobody, I don't know, like I was the only one that was like super concerned about it. Like I mean, maybe like other professors were concerned about it, but like nobody, you
Mm-hmm.
know, that like I think mattered. And so like I
Yeah.
had to really like advocate for myself to be like, hey, dude, I don't know what the fuck's going on, but like something's up, you know, like I'm
Mm-hmm.
not like I want to like what I'm about to say. Like I'm not saying that people, you know, who have to take remedial math class are like quote unquote stupid. But like in my mind, I was just like, you know, I'm not fucking dumb. Like you know,
Yeah.
what I mean? Like I can do
Yeah.
like all these other things. Like
Yeah.
so, what is it
Right.
with this thing? And
Same.
so you know, finally got tested. And at that time, there was like, well, you don't exactly have like a learning disability per se, like nothing that's in like the DSM-5, but the way you relate to numbers is different. I was just like, no shit. Like, duh, right.
Right.
And
Right.
so, you know, so I was able to get letters and accommodations and stuff. But, you know, it wasn't until, I mean, 2 years ago that I again like saw a psychiatrist for the first time. And, you know, because like the same stuff was going on, except now post graduate school, like I
Mm-hmm.
wasn't able to like in graduate school was a struggle, but like, you know, like I couldn't sit down and read.
Wow.
Like I was like, you know, I was like trying to read a book for pleasure. And I
Yeah.
couldn't even say like prior to that, like the last time that I read a book for pleasure. And like, of course, like in
Yeah.
grad school and undergrad, like you're not reading like cover to cover. So like
Yeah.
it
Yeah.
wasn't really an issue. Like I could read like chunks of stuff, but like to read a book, I would just like, you know, start reading it. I don't know, go wherever
Mm-hmm.
and then come back and be like, dude, I don't fucking remember. And then have to go back to the beginning of chapters. Like after doing that so many times, I'm like, man, fuck this book. And so then like I never like was able to finish reading a book. And
Wow.
so you know, I was just like
That's
talking to
nerve
my
wracking.
Really. And so I was talking to my PCP about this. And I was like, I don't know what's going on. There's a shit of numbers. Like, here's this diagnosis that I got before. Can't read a book for pleasure. And so like I went and got tested again. And this, there have been like, however many years between this, diagnosed with like a type of learning disability that they call like sluggish cognitive tempo. And so like they put me on Strattera.
What is that?
It's like a medicine that's used for like ADHD, but like it's not a stimulant.
Mm-hmm.
Yeah, I took that for a while and like was checking out my PCP, and I was like, I don't know what this is supposed to do, but like I don't think it's doing it. So after that for a while, like he referred me to a psychiatrist. And so, after talking to that psychiatrist, and to be clear too, like that referral to the psychiatrist, like came off the tail end of a bunch of hell, because while all of this stuff is going on, even like, all the way back to when I was an undergrad, in hindsight, I'm thinking about the different like intimate relationships that I was in. And like, I'm talking like hot fucking messes, especially with regards to, like my like impulsiveness, which again, I didn't know. Like hindsight, right? Impulsiveness and like 0 to 100. Everything was an argument, constantly like feeling like, attacked or again, like, and so fast forward to the psychiatrist. Like, and have like this long-term partner, and like things were like bad. Like I'm talking like bad. Like I'd been dealing, like I moved to Kentucky because my mom was dying. Like I was like unemployed for a very long time, and like that, along with like whatever was going on with my mind that I didn't know. Like, I mean, at one point, like I thought I was losing my mind. Like, on average, it would take me 5 times of going between the house to the car, of forgetting things before I actually like got in the car and was able to go. And like, like I literally one time, like after going back like a bunch of times, like busted out in tears. And like my partner was like, what's going on? I was just like, I just said like, I can't find my pockets. And like ultimately, like I, everything that's in my pockets, like for the day, like they come out of my pockets, and like I put them in the same place, because like I was like getting so tired of having to like go back and forth. And like sometimes I would get in the car and have to like turn around and come back because I forgot my ID badge. And so like while that's going on, me and my partner are just like arguing something terrible. And like I mean it's hard to look back on those times, because like I wish I could go back and undo it, because like I feel like they have dealt with so much shit. Sorry. They've dealt with so much shit. And like, just like really not great behaviors. Like throwing things, punching things, like, I mean, holes in walls, but like,
I don't know if you saw my post today, but I posted about domestic violence in relationships. And I have to say that I've been guilty of being on both sides of that. And it's been a long time for me, but I'm only now unpacking what drove me to these rages and violence. There's a lot going on that was the impetus for that behavior. So
I mean, and like that wasn't made clear to me until I saw the psychiatrist for the first time. And when I'm telling him like all of these things, like the academic stuff, the forgetfulness, and like seriously wondering like if I'm getting like early onset, Alzheimer's, or if I'm just like losing my fucking mind. And then like, the arguments, and like, just the quick to anger.
Sounds so scary.
Like he was like, yeah, well, it sounds like you have ADHD, and like you've had it your whole life. And, he was explaining to me the way that it presents in adults, and how like that's vastly different. But like the whole like feeling super defensive, like feeling like everything's attacked, like really like you're not having like the time, because like I'm so quick, like not having the time from like when something happens to being like, okay, this happened, and let's think about this rationally. Like, no, like, that's just fucking gone.
And
it's
so impulse.
yeah, it's just gone. And you know how like, yeah, like a lot of times like that presents as, you know, like these arguments. And like if you think about, you know, like a kid with ADHD
Mm-hmm.
and, you know, maybe how like they might act out, you know, it's the same kind of acting out as an adult, except you're a fucking adult and like your
Right.
fist will go through that wall. And now like
Yes.
there's a partner that you're scaring the shit out of.
Yeah.
Um, you
It's
know, so like
heartbreaking.
it, I mean, it is like
It's
it fucking
heartbreaking.
sucks. And like
Yeah.
to think back on everything to be like, oh, okay, like that makes sense. And then like wondering like, oh, like how would things have been different had I known then? And like, you know, during the time when I was in school, like nobody was checking for like Black kids with ADHD. Nobody was checking for those of us that were assigned female at birth with ADHD, right? So like I literally
Yeah.
slid under the
Under the
radar.
wire. Yeah.
Yeah. So like he started me on Adderall.
Mm-hmm.
And like,
Did that help?
I mean, it was like fucking ridiculous. And like, we had been going to couples counseling, and it was the couples counselor who referred me to like this specific
Mm-hmm.
psychiatrist who
Mm-hmm.
she really liked. And, you know, like I had been taking it for maybe like a week and went back in there, and she was like, so how's it going? And I was like, deceptively well. Because like seriously, like there were things that normally would have gotten on my nerves, right? That like my partner would do. I'd be like, whatever. And then I'd be in my mind, I'd be like, is that your final answer?
Right. Who is this?
Like, is that your final answer? Like,
Wow.
okay. So that really, really helped. And so, but
Mm.
then, yeah, so like that was really helpful. But then, like, yeah, like that wasn't the end of it. And so, like, I kind of, like, I was telling a friend, like, you know, over time, like, I feel like there's like all of the pieces have been there
Mm-hmm.
as far as like, you know, I don't want to say like what's wrong with me, but as far as like how my brain works, but like nothing ever like really came together as
Mm-hmm.
one cohesive picture until
Mm-hmm.
about 2 or 3 months ago. And
Wow.
so what had been
Wow.
happening after the Adderall, which was
Mm-hmm.
doing great. I mean, I don't know how to describe it, but like you know, something would happen and you know, like I would get like triggered. And I mean, like the way that my partner described it was what I was perceiving things as threats
Mm-hmm.
to which like required me to be defensive
Mm-hmm.
and like literally like was just like spiraling like out of
Oh
control.
God.
But like that wasn't my partner's experience, who I trust their experience,
Mm-hmm.
because I had to realize that like during those moments of like heightened like fear and like heightened
Mm-hmm.
like
Mm-hmm.
hyper arousal, like mine wasn't a reliable source
Yes.
of information.
Yes.
And I mean, that was kind of, I mean, like seriously, like one time we were in Denver when this happened, and I'm talking like just like whole fucking meltdowns, like in the car. You know,
Wow.
we were there for a wedding. I couldn't go to
Wow.
the wedding. Like my friend, like my partner had to like turn around and like drive me
Oh
back to where
God.
we were staying. I freaked my dog out. My
Oh
friends were worried, but I'm talking like just like, you
yeah.
know, and I would like feel like against a wall, and I would just like be like, I gotta go. So like, you know,
Mm-hmm.
here it is in Colorado. Like I just like, you know, pulled over the car and I just like got up and like started walking.
Mm.
You know, with my dog. And he's just like, what the fuck's going on? Or, you know, here one time
Archie.
it happened. Yeah, Archie, yeah.
Yeah.
And you know, like here it happened one time where, you know, and it's like small things that would just like blow up and like we would get into it
Right.
in the car. And I remember one time like I just like hopped out of the car because like I also felt like I had to like go, or else like I didn't trust like the amount of anger that
Mm.
was in me and like what would
Mm-hmm.
happen next. So I'd be like, I gotta fucking go. And I remember like one time like
Mm-hmm.
I walked from like downtown Louisville home. It was nighttime.
Yeah.
And like, I mean, it was like a 2 hour walk.
Wow.
It was like a 2 hour walk. And like I just like
Man.
was so fucking hot and just like, you know,
Yeah.
just walking.
Can I
So like
just interject here that for me, this, it sounds very similar to what was going on with me, but mine was untreated PSD. I had been getting all kinds of treatment, but just not the right kind, which I didn't know.
yeah.
And I also feel like in retrospect, a lot of my symptoms and unmanageability was attributed to me being a woman or me being trans. Like I just wasn't taken seriously. So I'm
No,
hearing
not
that in your story.
taken. And I've been like a lot of my friends that, you know, for different conditions, but a lot, I mean, at least like 5 other people in my life, you know, have been struggling with things chronically, like longitudinally, and are just now, you know, like getting to the point. And like, and it's not that like, yes, the doctor helped them, but it was like, you know, we're bringing like all of this information to them, like over the span of our lives.
Yeah.
And honestly saying like, hey, this is what the fuck I think is going on. And then the doctor's like, yeah, dude, I think you're right. And so, yeah, like that was, and so that was kind of like definitely like the last straw. Like I would forget things that happened. Like I would wake up and have, like, I would go to sleep, just like crash out. I would wake up and have like terrible, you know, like fucking
like
headaches.
blackouts.
Like, I don't think they were blackouts. Like I think, I don't know, I just called them like crash outs.
Okay.
You know, like I would remember like what happened. Like I remember that I freaked out. But like I would, like my head hurt so bad, I'm like, did I hit my head or something?
Oh my God.
And you know, but like Brady was like, I don't think so. And I, you know, like, so yeah, would just like kind of forget like the small things. But ultimately what was happening is that like my brain wasn't a reliable source of information, right? So
Yes.
like, I wasn't remembering what Brady was saying because like that wasn't my experience. And so I had, you know, it got to the point where like I had talked to we talked to our couples counselor about it, and you know, like I agreed that Bridie would talk to my individual therapist and would talk to my psychiatrist because I trusted their story and that was necessary. You know, like that was necessary for me so that like, you know, they could know exactly what was going on from their experience.
Right.
To be able to help me. And so that happened. And ultimately, like the doctor, the psych person ended up putting me on Lamictal, which is a mood stabilizer. It's an anti-epileptic. And honestly, like it's been really interesting and it's worked really, really well. And so it's a combination of Lamictal and Adderall. And so the other thing that's interesting is that, you know, like I didn't know that there was different types of ADHD.
Yeah.
And the kind that I have, it's, you know, it's 2 different kinds. And it makes total fucking sense. Like back when I lived in San Diego was the first time that a therapist talked to me about my limbic system. Which that's the part of your brain that's responsible for emotions and like how we interpret things, you know, or, you know, fast forward to, you know, kind of like the different symptoms that I've had chronically in my body. You know, like I developed like hypertension, not chronically, but acutely, or insomnia, like terrible fucking insomnia, chronic constipation, you know, and like these are things when you think about, and there's, you know, been like research now that talks about, okay, well, like we've got fight or flight. What happens when someone chronically operates in fight or flight?
Yeah.
What happens when someone has an overproduction of cortisol?
Cortisol,
midsection, you know, it doesn't matter how much I work out. I never lose weight
because of the cortisol
in my midsection, right? And so, you know, there is like an ADHD that limbic ADD. And so, you know, that it was responsible for, you know, like these moods.
Wow.
You know, like the flying off the handle moods.
Wow.
There is, you know, what they call, you know, like ring of fire ADHD. You know, which again, it's like this overly active, you know, part of your brain. It's like I have an overly active limbic system.
Does the knowledge of this, does this help you to know this?
Oh yeah. Like, I mean, like everything checks out.
Everything sort of lined up and fell into place and
everything checks out. Like one of the other things is, you know, like I had gone to the doctor, the ER, because of like my chronic constipation. Like every now and again, it would get like so bad that like I would be like, you know, doubled over. And so I went to the ER, and so like they did a CT scan, but like it came back normal, like as far as like my guts went.
Yeah.
In fact, they were just like, it was funny. They were like, well, you have no stool burden at all. And I was like, what the fuck? Like, what the fuck are you talking about? So like literally it was just like, you know, like my limbic system was just like out of control. You know what I'm saying? Like my
Wow.
adrenals were
Yeah.
out of control. But what they did find was that I had multiple cysts on my kidneys. And what? Right, I know, but like, check this is like mind blowing. So, the organ that sits atop of your kidneys is your adrenal gland.
Oh.
And what comes out of your adrenal gland? Cortisol.
Oh.
So, like, all of these things, like when you're thinking about them, like,
so they're going right through the kidneys.
Yeah, it's like it's my like my limbic system and cortisol is all fucked up. And so
wow.
Yeah. So like
that's
I think, like,
wild.
I know. And like the shitty thing is, like, unfortunately, doctors, like, you know, here in this country, unless they're like, you know, osteopath or something like that, generally are not, they're not trained for prevention, like they're trained for like tertiary level care. You know, but like generally, like, you know, they go too fast to think holistically.
Yeah.
To think about like your entire body system and like how like one thing so small can do that. And like, what's interesting is that there's tons of research that talks about like ACEs, right? Like these adverse childhood experiences, and which that's kind of like where, you know, my shit comes from. Like there's research that says like, hey, like when you've got a parent, generally a mother, like whoever's carrying you, that comes from like these incredibly stressful environments where they're in chronic fight or flight, and then they give birth to you. You're born with it, and then you grow up, and then you get this shit. You know, like that's what happens. Like you get this, right?
I just want to back up for a minute and explain, like, if you could explain again what ACEs is.
Yeah, so like they call them like adverse childhood experiences, and so like these are like, you know, these various like negative things that happen in one's childhood that, you know, can honestly like impact you on a molecular level, not just like physically and like socially, like also on a molecular level. So like these things can look like, you know, poverty. It can look like, you know, you being abused, or you just even like witnessing abuse. It could be like, you know, did your parents, you know, the parents who carried you, or I was just say parents in general, like use substances,
right?
And were you born? So like, for example, like we're foster parents, and so like our infant, you know, like she's got a host of issues. I mean, but one of the things is that she was born with a lot of drugs in her system, mainly meth. And one of the things is that, you know, when we first met her, among other things, she was like hypertonal, like just so tense. And, you know, one of the things with her physical therapy, and they were showing us how to do this baby massage, because now they know this stuff, right? Baby massage. So one, try to get her to relax, right? But these other things that she was doing is that, you know, she was an infant, so like, but she's still like trying to lift up her head, not because like that's where she's at on her developmental milestone, or because her head is even strong enough to support that. She's in fight or flight.
Oh, God bless.
That's how her body is reacting. And so like, you know, trying to massage her to relax her system,
so she can be a baby,
so that she can be a baby, and so that these symptoms don't continue to develop stronger over time, and like compound on each other. You know, so that she can have, like, you know, in addition to like all of her other things, like that's not something, you know, that we want her you know, like to have to worry about, because truly, like, I mean, those things, you know, I often wonder, people, like when I look at people, you know, specifically folks who, you know, are Black or African American, you know, like a lot of us disproportionately have diabetes, have high blood pressure, carry, you know, midline adipose tissue, and oftentimes, like
which is trauma.
Right, exactly. And I would love to see, like, what are the cortisol levels, right?
Yeah,
like, like because like, I get so tired like in research, like when people talk about like, oh, like here's like this disparity and like here's this risk factor, and like one of the risk factors is being African American. It's like, no, that's lazy research.
Yes.
Right? Like that's
Right.
not a risk factor.
Right.
That's not a risk factor.
Right.
Like why? Like
Yes.
why is it that African Americans are disproportionately impacted by blah blah blah?
By risk
Why
factors? Why are they?
Yeah, like why is it that Black trans women are disproportionately impacted by yada yada yada? 9 times out of 10, it is like some type of social, like a literal social and or like systemic determinant.
Yes.
Not, like just our fucking race, or like just our gender identity, or just our sexual orientation, or just the fact that we were poor. Like it's not as simple as that. That's lazy.
Right.
But yeah, like I mean, just in thinking about that and like being able to look at it like, from like my public health background, but then also like looking at it as a future provider, like specifically in reproductive health. Like it's just been like really interesting. It's been like a super duper, long journey, but I would say like, for the first time, like, I don't know, like I dare I say like feel normal, like, I mean, where like things can happen and,
you can trust yourself.
I'm able to trust myself, and I'm able to, like if something's not cool, like I'm able to verbalize that better, and like everything's not an argument. Or even if I do like, get agitated, like I become like I'm short, like rather than like violent. And then even in those moments, like I'm able, it doesn't last as long, like it doesn't, like there would be times like I wouldn't talk to my partner for like days.
Wow.
Like for like days, because like I was like so angry and like didn't trust like, what was going to come out of my mouth. And I just like want to fucking argue. And like I knew that it was just going to be an argument. So like those periods being shorter, and then like, me being able to, like come back and be like, like this could have been done differently, or like, if I get really, really, there was something recently where I got like super, I was just like on edge, and I was just like, hey, I'm going to do X, Y, Z, and then I'm going to take a fucking walk, So like still being able to be like, okay, hey, like this is where I'm at. Can't exactly like, not really like able to like verbalize exactly like why I'm upset, but like I am like on 10 and, not abandoning you. I'm going to finish this thing, and then I'm going to go walk it off. So like just being able to do that.
Just adult like, behavior.
Yeah.
It's adult human normal behavior.
And like, like, and I can't, like, go ahead.
I often feel the weight of decades of bad behavior, or behavior that was induced by what I consider, trauma is a kind of a stupid, fucked up word, but all the stuff I've been through, right? The trauma of whatever I've been through. And I can carry that weight, and sometimes it's really fucking heavy. Or do you struggle with that?
Yeah, I mean, like, I could think and belabor, thinking back on like past relationships, but like just thinking about, the one that I'm in now, like, we've been together for like, I don't know, like 7 or 8 years. Yeah, it's been a long time. And, we've been married, coming up a year on Juneteenth. And it's like, again, like it's hard for me to talk about without getting like emotional, but like I have like so many like regrets, and like I beat myself up a lot about that. Like when I just think about like all of the shitty things, and like, like how justifiably fucking scared they were. And the fact that like, we always wanted to, like be parents, and, like my partner justifiably worrying about like bringing kids into our home and into our lives. But like, feeling like that much of a liability, but also like it, also being like really fucked up, because like, that's not who you are as a person. And you don't, and you literally don't understand. You know what I'm saying? It's like, okay, like if this isn't who I am as a person,
right,
then why do I keep doing this, right? Like, like why do these things keep happening over and over again? And that's like kind of like the rationale, right? That like, it's like, okay, well, like if that's not who the fuck you were, then you wouldn't be doing it all the time. And like not, but like that's all you have. Like you don't have like, this other understanding or a diagnosis, or like you don't know that
Yeah.
there is like medication,
Yeah. There's
and
a
therapy that can help you
fix.
with that.
Yeah. Yeah.
But like in order to get to that point, like you've got to have like all the information. If like you said, like a lot of
Mhm.
us don't have that information.
Right.
We're piecing it together,
Right.
on our own. That's really, really hard. But
And
like, yeah,
finding
like,
someone to listen to, like we're doing all the
yes.
labor, and then trying to find someone who will hear us, which
Yeah, and like trust you
and
as like the
trust.
expert of your own body and like your
Yes.
own fucking experience, and like,
Yes.
be like, okay, yeah, like it sounds like you've been through, fucking hell. And like maybe you don't know what's
Mhm.
going on, and I don't know what's going on either, but like let's figure
Let's
this out.
figure
And
it
like I'm
out.
listening to you.
Yeah.
So yeah, like I do definitely have like like a lot of regret. Like my therapist, it's easier said than done. It's telling me all the time that like I don't like I don't get to decide what Bridie's capacity is. Like I
Yes.
don't get to decide like whether or not they would be better off without me, which I feel like all
Oh,
the time.
good.
You know, but
But
like, and I know that that's not true.
right.
But like during those times, like when I'm, when I haven't been my best self, when I think
Yeah.
about all of the bullshit, like Jesus, like they deserve so much better than that.
Hmm. But she's your partner, and
Yeah.
she knows the drill.
Yeah.
Also,
So yeah.
I feel like I guess I have the benefit of coming from the recovery community as a drug addict, which has allowed me, I acted out and I did terrible things. I was a terrible person for a great many years, thanks to drugs and alcohol, and find that when I'm not using, I'm, this other person. But I have to live with all that damage that I've inflicted. And one of the things that sustains me is knowing that I can be of help. I can be of service. And I think you telling
Yeah.
your story right now is so fucking powerful. Truly, Zion, I really appreciate it.
Yeah. I mean, like I'm always, like I'm always down to, to talk about it. Cause I mean, yeah, like, there's lots of people who hear something in this that like sounds familiar, to them.
Mm-hmm.
And like, maybe this, helps them as they're going, on and like trying to piece together,
Mm-hmm.
like stuff, in their life,
And as
like
you
that
say,
guy.
as you say, Black trans people, particularly, how many of you suffer from the not being heard, not being
Yeah.
seen, not yeah, and so
And like, yeah. And like, don't even know that like don't even know like how that like impacts us, like not
mhm,
just like as far as like health outcomes go, but just like like emotionally. And like some people, like I'm super lucky, that like or better yet, like I'm super privileged in that like I'm really great at advocating for myself. I always say like I'm cool with being in somebody's bonnet, like you just show me the person. Like, but like not everybody is like that. We've
yeah,
definitely come across that with our foster kid who needs a lot of healthcare.
mhm,
And like when we've interacted with doctors, they've asked like, are y'all in medicine? We're just like, I'm just like, dude, I'm a fucking student. My partner isn't. But
yeah,
like, it's just like, no, like we understand the importance. Like, we also have that health literacy, right? Like that we understand that importance
yes,
of knowing like what is going on, and like understanding that like, no, like we get to ask all of the questions. I don't give a shit how
mhm,
much time you have.
mhm,
Like we understand, like we can fire you, right?
mhm,
Like if we don't feel listened to, if we don't feel heard, if we don't feel valued, if we feel like you're not listening to our kid or valuing her or like have her interests at heart, we will fire you.
yeah,
Like people don't. A lot of times, like people don't realize that, they don't understand like, yeah, there's this power dynamic,
but you have the
that
power. You can have the
exactly,
power,
exactly. They have the degree. Nobody gives a shit about that.
right?
It's your body, right? Like it's your body, it's your life, it's your health, and they don't have a degree in you, right?
Yes,
So like
yes,
you're the expert there.
yeah, absolutely right. Wow. That's great stuff. Is there anything that you want to leave the people with, or?
Yeah, I mean, like, I always just say, I mean, I think, like, especially in, like talking to, Black folks, or, people who, um, identify, more masculine of center, whereas the bulk of us, were raised, without great role models, like in masculinity, especially with regards to emotion. So I always say, like, it sounds mundane, but it's like, no, dude, like, this shit doesn't make you weak.
Right.
It doesn't make you any less masculine. Like, it's important to, like, talk to people in your life. It's important to have a therapist. It's important, to take medication should that be recommended to you, and, weigh the pros and cons of that. Like, I'm always going to have to take something,
Yeah.
and that's just that.
Yeah.
And, but like, that's okay. Like, you have to, again, like, weigh the pros and cons, think about, kind of like what's taking place across your life, and will trying this medication or this therapy or whatever, will that benefit your life versus the cost that you've experienced across your life, because there are costs to not managing your mental health. I'd also say, find something that grounds you, however that looks for you. If it's like gardening or working out, like, for me, like, it's capoeira, and that has been like a complete total godsend.
That's amazing.
Like, find something that you can do that is yours, and like, that is your time, away from your house, away from your partner, away from whatever. Like, this is just your time, to do whatever it is that you do, that helps you feel better, and wherein, like, you feel like you're your best self when you do it, whatever that is. So yeah, like, those are just like the key things. Just, don't, like, I mean, like, I don't know, I'm always a fan, like I say, like, all the time, like, work smart, not hard. Like, don't struggle.
Right.
Like, don't struggle if you don't have to.
Right. Yeah. We've struggled enough. We've struggled enough.
Don't add to it. Like, don't add to it.
Yeah. And I think you brought up 2 points that interest me. One is that I think the things that we can do to enhance our lives or to give us joy, one thing that we should do should be physical. Like, I really believe in physical movement. Yeah.
Yeah. And, like, you don't have to be like a weightlifter,
No.
like, just some people, it's dancing, I don't know, you want to take a walk. Peloton is fucking awesome. They got a payment plan.
Oh, wow.
Like, we benefit from it. Yeah. Those bikes are expensive, right? But, like, hey, affirm, but, like, like, different, like, walk your dog, like, like, whatever it is. It doesn't have to be anything like major, like, just like, moving your body, like, and honestly, just like, sweating it out. Like, I did I was on a podcast back in April, like, about capoeira, and like how that's helped my mental health, and like, I mean, literally just like sweating is like, so
it's
it doesn't
good.
matter, like, if it's in like a sauna, or like, if you just live in like the oppressively hot South and you just walk outside, like,
I love it.
Like, just sweating is so beneficial. Like, you really get to, like, kind of feel like you're tangibly,
releasing.
Like, releasing. Yep.
Yes, I love it. I love to sweat. The other thing that you said earlier, which is sort of tangential, is that you had someone in your life that you trusted to that you knew that what you were experiencing wasn't necessarily what was really going on, and you had a person that you trusted who could see and could identify for you what was really happening in the world.
That, like, and just like, I mean, there's lots of people, like, I've got my partner who does that. Like, I've got a friend who I've been friends with since we were like 14. I can trust that, if I'm out of pocket, like, they're not afraid to be like, yo, dude, you're fucking out of pocket. Like, and then just, kind of like between those things, like, have kind of like set up like a system of kind of like checks and balances, where it's like, if I'm getting like too amped up, like, for starters, like, I use my Apple Watch or whatever kind of watch you have, and like, I have it set to where like if it registers that I've been at rest,
Mhm.
you know, like I'm not moving around and my heartbeat goes over 100 beats per minute, that's an indicator, right? Of
Yeah.
like more than likely like something's happening. And so, you know, in those moments, I'm just like, okay, like whatever I'm doing, you know, even if I'm sitting in class, like, you know, I will just like, you know, stop what I'm doing, like close my eyes, take some deep breaths because like heart rate is an indicator for me that
Mhm.
like you're getting ready to get, you know, amped. And so if that's combined with an argument,
Mhm.
that is an indicator of like, all right, dude, you need to fucking walk it off. Go take a
Wow.
walk somewhere.
And how powerful to know that finally.
Yeah.
Wow. Yeah. That's amazing. Well, thank you so much, man. I really
Yeah, no
appreciate you
problem.
talking with me. And I think this
Yeah.
is such useful information. Like, it's really blowing my mind. Thank
Yeah, well,
you.
I'm glad that I got you, and I'm glad that you thought about me to do it.
Cool. Well, enjoy the rest of your day,
You
and
too.
I will be in touch.
All right, sounds good.
Take care.
All right, bye.
Bye bye.